testosterone. Welcome back, YouTube. Sorry about that little glitch. The question was best way to get testosterone. So testosterone, there is no FDA approved or commercially available testosterone for women. There is commercially available gel for men that I have seen women try to take less, but the dose for men is 50 milligrams. The dose for women starting is about a half. So I don't know how you give 1/100th of a dose. It's like just a dab. That's not very scientific for me, so I'm not comfortable with that. So it has to be compounded. We can give it as a gel, which is like a cream that you put on your leg. We've given it as a troche, which is a melt in your mouth. For some people, you're not supposed to swallow it though. I've given it as injections for people. So there's actually quite a few ways, just not oral as a pill. So those are the ways that we prescribe. Okay, Jules, back to your question. Taking tamoxifen for almost 3 years, atypical hyperplasia. What can I take? Jules, it really depends on what your symptoms are. There are some non-hormonal symptoms if you're having hot flashes. There is no reason why you shouldn't be able to take testosterone if you need it, or DHEA. So I end up seeing a lot of patients that are either high risk for breast cancer or breast cancer survivors for hormone evaluation to both prevent recurrence and then see what safely to use. So there are plenty of options. It's just everyone gets super nervous about it, but you don't. So it doesn't sound like you have breast cancer. You have atypical hyperplasia. Lindsay, thank you for reminding me. Yes, pellets could be a good option for testosterone for women. What I see though is a lot of overdosing. So if the dose was given the right way, it could definitely be an option for women. And if it was monitored correctly. Nadia Toll, which one is better, compound or androgel? So I like the compounded better because I like a personalized dosing. I'm not comfortable with like, just give a dab. I mean, testosterone is regulated like a narcotic. How can it be safe to give in an exact dosing? That's just I'm a kind of a detail person. No Name, can I take estrogen patch if I have oral migraines? Great question, No Name. The indication is for oral contraceptives that you can't take for oral migraines. There is some concern that with hormone therapy, you could have some what we call increased risk of cerebrovascular, like maybe stroke. But I have safely given my patients a topical patch of estrogen who have migraines with aura. So it really depends. Happy Mom. So you suggest progesterone, estrogen, and DHEA. You know, we personalize our recommendations for all our patients. Some people have normal DHEA. Some people don't need estrogen yet in perimenopause. They just need progesterone. But yes, I give all of those hormones, including testosterone. Pray for Selena. Good evening. Thank you for joining to my Tune In Tuesdays. American Angel, is acne caused by using testosterone? So testosterone, it's all about the dose. As I mentioned, men produce 5 to 8 milligrams in their testes every day. Women produce a half a milligram in their ovaries every day. So that's a big difference. Dosing of testosterone for men is 50 milligrams to 100 milligrams. So if you give a woman 50 milligrams, yes, you may get acne. So if you give a woman a half a milligram, 1 milligram, 2 milligrams, you may not get acne. No Name, I'm glad. So please see someone who is well-versed at looking at your hormones. I don't know where you are. I see a lot of people in Akron, Ohio. Dr. Jen Simmons is in Philadelphia. She's another person well-versed on this. Elizabeth Boehm is out east somewhere. Okay, Jenny K. My doctor increased my progesterone to 200 milligrams a few months ago. Constantly hungry. Is that why? That's really interesting, Jenny. So one of the side effects of too much progesterone can be disruption of your insulin and insulin resistance. So I would definitely get your metabolic hormone checks. Insulin, glucose, and an A1C. Kelsey, when can I get my hormones tested postpartum? It depends. If you're still nursing about 6 times a day, the thought is that you will have still low anovulatory hormones. So it depends on it depends on how far along you are and if you're nursing or not. If you're not nursing and you're cycling, you can get your hormones checked anytime. Laura Alicia asks how she can see me. I work for Forum Health Akron. I have a medical license for the state of Ohio. It is Ohio's rule that we see patients face to face first. So yesterday, I had a patient drive in from Pennsylvania. The first visit has to be face to face. After that, she can see me the rest of the visits as a virtual visit for a year. Keep in mind, I have 2 excellent nurse practitioners and also a physician's assistant who are excellent. They can see patients, a lower entry fee. So that also is a great fit for people. Mary Daniels, I know I've seen you on here before. Thanks for joining in. You're in the throes of perimenopause on HRT. Better, but still low mood. Is that expected since my hormones still fluctuate? Mood is a funny one. Mood will go up and down with fluctuations in estrogen. And that's why we generally check hormones about every 3 months. There are some devices I'm trialing that patients can check their hormones at home, but it's urine and it's not the same. It's a device called Mira. I just checked my hormones this morning. I'm kind of just playing around with it to kind of figure it out. So that could be an option as well. Prayerful Selena, I'm 5 years postmenopausal. Do I need any hormone help? Well, not everybody needs to take hormone therapy, but the people who have hot flashes, vaginal symptoms, or are concerned about bone loss, those are the reasons to take it. But I think everybody deserves to have their evaluation to see where their levels are and to be told of the risks and the benefits and the alternatives to see if you need it. If you're 5 years and you haven't reached out, you must not feel that bad. But my sister was 2 years without a period and said, I'm not having any hot flashes. I'm not having any problems sleeping. I don't have any problems with my energy, but my weight has gone up. And so I told her about the risks and benefits, and she talked to her doctor, and she's decided to try hormones. And guess what? She said, hey, you know what? I actually have so much joint pain that I don't have anymore. That was her symptom. It wasn't hot flashes. So it just depends. Mrs. Wombat. Cycle of estrogen and progesterone altering weeks in mid-50s, complete hysterectomy 20 years ago. So if you had a complete hysterectomy 20 years ago, I don't necessarily think you need to cycle things because how are you cycling? You don't have a menstrual cycle. Are you cycling based on the calendar? So that's one way to take things. It just depends. I mean, obviously they're not trying to get you to have a withdrawal bleed. So a lot of times we do have patients have a drug holiday of 1 day a week. So that may be an issue. No name, you're in Canada. Well, I'm about 4 hours from Detroit, not Detroit, Toronto, and about 7 hours from Sault Ste. Marie. I had a patient drive down from there. But there could be a lot of providers in Toronto. I know we did a lot of courses. I taught a lot of courses, and there are a lot of providers who are well-versed at hormone therapy. And also in Vancouver, I have some colleagues in Vancouver. Okay, let's see. When you reach your age, Ashley says, when you reach your age. Ashley, I don't know if there was another part of your question. Sometimes they're getting filtered because I don't see the rest of your question when you reach your age. Suga, I'm postmenopausal 51. Year old AA. I'm not sure what AA is. I'm literally going through hell. What are the risks of cancer of HRT? Thank you for asking that. That is well published according to the position statement in 2022 by the Menopause Society. Your lifetime risk being a woman, being born genetically a woman, is 1 in 8 or 13% if you do nothing. That's your risk of breast cancer lifetime. If you choose to take bioidentical hormones, that increases your risk by 1 in 1,000. So your risk goes from 13 to 13.01. So that's thought to be a very low increased risk, although I can't say there's no increased risk. If you take synthetic hormones, the risk is 3 out of 1,000. Okay. Jenny, I am in Akron, Ohio, near Cleveland. So that's Northeast Ohio. Mrs. Wombat, they cycle estrogen and progesterone. Oh, as a question. Okay. If you don't have a uterus, you don't have a cycle. And people with a uterus is what we cycle. So based on the calendar month, you might have what we call a hormone holiday, like a day a week off. But I wouldn't really call that cycling. Cycling sounds what you said, 2 weeks on, 2 weeks off. And I don't think that's necessary for someone without a uterus. Mary, is menopause easier after perimenopause since hormones are stabilized? Yes, I believe so. I think perimenopause is harder, and that's why I feel like the perimenopausal women aren't really getting the attention and solutions that they deserve. Menopause women are getting more help. Like I said, since Oprah had a special, and since people have written textbooks about it, and because there's the menopause and there's all these things, but it's these 30s and 40s women that I feel really called to help. Amanda, why did MIDI Health say no need to check my hormones after being on HRT for 3 months? So that is the traditional guideline, is to not check hormone levels. But let me give you a little comparison. The Endocrine Society says for males that we should check hormones, we should give hormones and monitor hormones. The Endocrine Society says for transgender hormone therapy that we should check hormones, give hormones, and monitor hormone therapy. Why is it that for women, the protocol is just give hormones and not check? I'm not okay with that. I want to know. I want to know. There's lots of data that says there's a certain level of hormone therapy that can help your brain, help your bone, mostly your bone, that's been defined. There's a certain level that can actually see if you're high risk for other things like osteoporosis and breast cancer. Oh, Suga. Okay, thank you, Suga, for qualifying. A lot of times, African Americans, it's statistically shown that they have worse hot flashes. So please think about finding someone who would be open to helping you that has training in menopause. Okay. Ashley, I'm 32. Is it true that hormones don't really need to be checked? I've had 2 kids. Well, so I have had hormone problems my whole life. Since a teenager, I had infertility. I had hormones checked then. And when I was 38, it's when I started needing my progesterone. So I've been checking my hormones most of my life, with the exception from 30 to 38. I think it's information that I think is helpful. Do you need to have them checked if you're having no issues? Maybe not. I stutter. I'm 62, need energy. So energy, low energy can be from low estrogen. It can also be from low testosterone and low DHEA or cortisol problems. Shelley, learning risk of what? I think you came in on the end of our risk of breast cancer with hormone therapy, bioidentical hormone therapy, 1 in 1,000 or 0.01%. Monica Yanni, is acne along the jaw hormonally? Traditionally, yes, we think of along the jaw and around here, more hormonal acne. It's more important than also when does it happen? Does it happen right before or after your period? Sarah, I'm having panic attacks after 7 months of no menstruation. I'm sorry that you're going through this. And yes, I often see when you have a drop in estrogen, that's when new onset panic attacks come. So please find somebody to work with you about your hormones. April, complete hysterectomy due to a severe endometriosis sensitive to estrogen, but I have gained 3. One of the reasons, April, is that after hysterectomy, a lot of times patients just get estrogen and they don't get progesterone. So that could be why you're having some symptoms and you're having some weight gain. Estrogen is a growth hormone and it needs its balancing progesterone, regardless of whether you have a uterus or not, in my opinion. There are some studies to back that up also. So April, I would definitely get evaluated for your androgens, your cortisol, and your progesterone. Kim Wash, 2024. I've been on bioidentical hormones for years and loved it. Great to hear it. I'm glad you've had a good experience with it. Kittens Rule, I'm on an anastrozole, falling triple positive. BC, how can I counteract the joint pain? Diet recommendations. Try to think about eliminating inflammatory foods, gluten, dairy, processed food, sugar. Think about taking turmeric, also maybe some fish oil. Those could be things that could help your joint aches. Anti-inflammatory like turmeric, boswellia are really great for joint aches. Gecka 13, how can I know if I'm in perimenopause? I've been on continuous birth control. Great question. Because the definition of perimenopause depends on your menstrual cycle, and you're not having a menstrual cycle when you're on a birth control pill, especially a continuous birth control pill, it's going to be hard to determine for you. With my patients like you, we have them do a pill-free week and get the labs done at the end of the pill-free week. That still doesn't guarantee that you are or aren't in perimenopause, but it's one way to tell. You won't really know until you go off the birth control pill. God's girl, how do I make frequent irregular periods stop? Stop taking progesterone and testosterone. So frustrating. Yeah, you shouldn't have frequent irregular periods. I wonder how you're taking it and what the dose is. That could be part of the issue. 1,812,098,18. I'm 38. My neck is just so bad on a daily basis. That's interesting. So it's just your neck. I wonder if it's a histamine issue, if it's a food sensitivity, it's a gut issue. Those are things that I would think about. But I also would think potentially low progesterone. Pay attention to when the itching comes. Is it sometimes, the week before your period, and it goes away when your period comes? So check that out. Farm chick. Will HRT cause weight gain? The funny thing about HRT is it's dose related. So not enough HRT, you'll gain weight. Too much estrogen, too much progesterone, you'll gain weight. So it's all about dialing in the dosing. And that's why I don't know how people do it without checking levels. Tater tangerine bilateral endometriomas have returned status post laparoscopy. Can I try NAC, not on birth control pills? So I don't know, tater tangerine, if future fertility is a concern for you. NAC is one of the things that has been proven to help endometriosis. But when you get to the point where you have endometriomas, it's considered severe endometriosis. I don't know how big those are. I have had patients that have gone on Orlissa or Myfembree. Those are two new medications. And I had a patient that had endometriomas, both sides, that shrunk with the Orlissa. I don't know if she's Orlissa first, then Myfembree, or just the Myfembree. So there is some options of medications that aren't as bad as the Lupron. So depending on whether or not you want to be pregnant in the future, it may be something that needs some attention. Purple Heart, good to see you. I was looking up different supplements and herbs, and nearly everything interferes with HRT. Wondering what interferes with it, because we have a lot of patients that are taking HRT. I'm taking HRT, and there are herbs and supplements that I'm safely taking. So, medical mushrooms, cordyceps, astragalus, St. John's worts, oregano oil, black seed oil. Okay, let's take that. Let's break that down. Medicinal mushrooms. I think that there are some patients that are microdosing that, but we don't have a lot of data on those as far as mechanism and interactions because they're new. Cordyceps, I know I've taken cordyceps when I've taken my hormone therapy and no problems. St. John's wort has a lot of side effects to antidepressants. Oregano oil is aimed at gut health. So I have a lot of patients that take that while they're on HRT. So I don't really know what interaction that is. I would ask. Rosie, does progesterone postpone menopause? That is a great question. I do not think that it postpones menopause when you're using physiological dosing. I think it mitigates the symptoms. It helps the symptoms of perimenopause. You're born with so many eggs and you release an egg, and when you're out of eggs, that is when you're in menopause. That's the only definition, really. So I don't know how progesterone can postpone it. Christine, thank you for sharing the live. Kim Wash, your mammogram was normal. Kim, you asked me a question. Oh, bioidentical hormones. Okay. Yep. Great. Okay. Let's see. Lisa, if one has been in menopause for 9 years, is it too late to get bioidentical hormones? Lisa, it is very important to know how long your age is. If you are less than 60, it's not too late. If it's 9 years since your last period and you're over 60, you're within 10 years. But girl, 10 years is the safest time to start it. It doesn't mean you can't start it. It just means it's safest okay, now 56. Kim, you're telling me now you're 56. Okay. But Lisa, I don't know how old you are. Shan, 81. I'm 44 and had a hysterectomy. What dosage range is usually good for estrogen and progesterone? Dosage. Okay, so most common doses that my patients are on is a 0.0375 patch, anywhere to 0.05, 0.06, and 0.075 are the most common. Progesterone, we only have two doses, 100 and 200. So and the lower doses of estrogen is going to be 100. 200 will be the higher doses. I do have some people compound different doses. I myself am on 150. Janice, can I start HRT if I went through menopause 8 years ago? I mean, it's still safe up to 10 years. There's still benefits outweigh your risk. That's what the details say. Patty Pan Jones, I just found out that sometimes there's filtered. So try asking your question with different words. I have not skipped any, and your question hasn't appeared to me. So there must have been something that has filtered your question. I'd love to answer it if you just want to restate it. Oh, Lisa, you're 65. Let me see. Let me go back and see what you said. You were asking about, okay, 9 years. Woo. You're, I have started someone that age on hormone therapy after a full cardiometabolic workup. I just think you got to get in soon. Okay. And you got to get to a knowledgeable provider. Let's see. Just started testosterone about a month ago. Love it. Christine, I'm glad that you're feeling better. It's made a big difference for me as well. Oregano and black seed oil are both estrogenic and strong emanagogues. Made me start a period. That's interesting. I have not experienced that with my patients. We frequently use oregano oil for gut dysbiosis, but thank you for letting us know about your experience. Cromartie, what symptoms indicate one may need an increase in progesterone dose? Like if you're still having night sweats, you're still having shorter periods. If you're having periods like they're 24 days, 25 days, that can mean low progesterone. You're not sleeping, your moods are still a problem. That could indicate you need some more progesterone. Okay. Okay. All right. Yeah, Lisa, go make an appointment tonight, right? Okay. So for those of you that are just joining, I was telling everybody that I'd love for you guys to click the link in my bio and sign up for our free newsletter that comes out every Tuesday. I would also love for you to subscribe on our YouTube channel. We're constantly putting videos up there. I think it's a little hard to search on this format. I've got so much content on TikTok, and there's stuff that was posted years ago, and this way you can search on YouTube. Also follow me on Instagram. It's Hormone Guru. We've got a new online course that is free. Shan 81, does progesterone cause bloating? So the lack of progesterone can cause bloating, and too much progesterone can cause bloating. So if you are taking too much and you don't need it, that could be. Sometimes people order progesterone cream over the counter, and the dose is too high. Sarah Faye, I'm 46 years old, 2 periods a month for the last 2 months and really bad cramps. That sounds like a lot of estrogen, Sarah. It sounds like you might need progesterone. I would love it for you to get assessed by somebody who deals with hormones. Mary, since hormones fluctuate so much, should women be on higher dose of HRT than menopause? No, it's actually the opposite. Perimenopausal women have high swings in their estrogen. Now, they could need a higher dose of progesterone to counteract that, but usually they don't need higher estrogen than menopause. Peter's on Homestead. I had an ablation 7 years ago. I'm now 52. In the last 2 years, definitely having menopausal symptoms. For you, it's harder to tell when you're menopausal if you don't have a period. So we do labs 2 times, 4 months apart. You need an FSH above 40 and a low estradiol. That's how we diagnose you if you don't have a period because you've had an ablation, or because if you've had your uterus out and you still have ovaries, or because you have an IUD in. Let's see. I'm going to try to get through the rest of the questions before our live is over. I haven't gotten my period since March. I have PCOS, stopped taking Diane pills. What can I do? Nick, so one of my favorite supplements for PCOS is by Da Vinci Labs. It's inositol plus Vitex. But I would highly encourage you to get your insulin checked to make sure you're not insulin resistant, and get your labs checked for PCOS. American Angel, I've been prescribed topical estrogen and testosterone. Is it best to use AM or PM? Great question. Both of those, we generally advise you to take them in the morning because that's when you naturally produce the most of testosterone in the morning, and estrogen as well. Something more natural for joint pain and menopause. And Grady, a lot of my patients have had good luck with curcumin or turmeric. Sometimes you see it packaged with boswellia, which is frankincense. Glucosamine chondroitin can also be helpful, but my favorite is curcumin. What's the best test to get an accurate progesterone reading? That's a great question, No Name, because that's been debated, and that's what we talked about, is progesterone levels are very erratic no matter how you test them. If you're testing your own body's hormones, blood testing is the best way to go. If you're testing progesterone that you're actually taking from the outside, I do them all. I don't know that there's one that's more accurate. I like to check in the middle of the luteal phase, which is around day 19, 20, or 21. Patty Pan Jones, can you reframe your question, please, and see what it is? Okay, on YouTube, if progesterone downregulates estrogen, aren't we wasting the estrogen? No, it downregulates the estrogen receptor, and the body is amazing at maintaining homeostasis. So it's not going to downregulate so you can't get enough estrogen. It's going to get it back in balance. Yeah, Patty. So see if you can rephrase your question because I'm not seeing it here. Peter at home said, I ordered Winona as HRT. Any opinion? Got a mix of estrogen and progesterone. I mean, I'm glad that there are some companies out there that are giving you guys some options. Some of them are not testing, some of them are. But I guess in the end, the good thing is that you're getting some access to care. Feeling sleepy all day is low estrogen. It could be too high progesterone. It could also be a cortisol issue. Sarah, what kind of progesterone should I take? My gyno prescribed some, but I was hesitant in taking it. Unless it says micronized progesterone, Sarah, it's not bioidentical. Micronized progesterone, it could be called prometrium. Can you discuss bioidentical progesterone for PCOS? So normally we have you start it 2 days after ovulation. And you can take it vaginally or you can take it orally. We prefer orally because it's less messy, and take it until your period starts. Any help for hair loss? Gosh, you got to find out why. Is it high testosterone? Is it low testosterone? Is it high estrogen? Is it low iron? Is it thyroid? So we would want to look for the cause first. I do know people like some of the Nutrafol supplements, or I like the actual serum. What do I think of DIM? We use it for people who we know need it after we look at their estrogen metabolites. Kelsey, I do not know anyone in Massachusetts. Chazza, I've just started the gym. What supplements should I take apart from creatine? Creatine is something I just started. A lot of people like collagen. A lot of people like magnesium because you can deplete your magnesium and get some cramps. Patty, is this your question? Alternate ways to take micronized progesterone to protect. You can get it vaginally. You can get it as a suppository, and if you're perimenopausal, you can get it compounded as a cream. We've also given it as a troche. All right, guys. Okay, Sarah says 200. What was your question, Sarah? I got to go back and look and see. I'm going to get one more question. Oh, what kind of progesterone? So that does sound like it's bioidentical, Sarah. Okay, Cindy, you are the last question. Support or oppose starting HRT in 70s? Asking for my mom. I want her to get on a patch. And progesterone. I can't say yes or no. I would need to know that patient's detailed cardiovascular history, her cholesterol levels, her insulin, her glucose, everything, her history, before I could make a decision whether or not to start it then. Okay. Okay, Rachel, your thyroid and your estrogen is linked. My husband has low T and hypothyroidism. So I would be looking at his adrenals. I would actually be looking at his cortisol because that's probably the issues. Thank you for everyone who tuned in. If you haven't subscribed to my YouTube channel, Tara Scott MD, follow me here. Follow me on Instagram. We have lots of free things here. We have a free mini course. We have a free download of perimenopause testing. So I'm glad you joined in on Tuesdays, Tune In Tuesdays. I think I'm going to be here again next Tuesday. I don't think I'm traveling on Tuesday for a few weeks. So we're trying to be here Tuesdays, 7 p.m. Eastern. Come on and ask your questions. Let me know what you guys want to hear about. Thank you for journeying in. And I'm so glad to see some of you repeat again. Would love to see you subscribe to our newsletter and have a great day. It's finally summer. Enjoy your day.